Let's talk about peroneal tendon subluxation around the ankle. I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of the book, That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on all sorts of sports and exercise injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. Peroneal tendon subluxation is probably not one of the more common injuries around the ankle, but can really be one of the more debilitating ones. The peroneal tendons are the tendons along the outside of your ankle, just to the outside of that bony prominence on the outside of your ankle. And they're involved in turning your foot outward, what we call eversion. And you typically suffer this injury through an ankle sprain, some sort of inversion injury and a twisting injury that tears the tissue or the sheath that holds those tendons behind that bony prominence, the lateral malleolus. Then what happens is all of a sudden those tendons can start flipping back and forth across that bony prominence, and it can be really irritating. Unfortunately, non-surgical treatments don't typically help that much. When you come to the doctor, yes, we're going to examine you, we're going to get x-rays, probably don't need to get an MRI unless we're worried about some other injury also occurring, because we can reproduce the symptoms. We can put your ankle through a range of motion and cause those tendons to snap, so it's fairly easy to make the diagnosis. Again, non-surgical treatments like taping and bracing and rest and physical therapy, usually not successful to get that tissue to heal and keep those tendons in place. So very frequently we talk about a surgery, if it's fairly soon after you just had that injury, to reattach that sheath and then protect it with a boot or a cast to get it to heal. If it's been longer, and now we're months out, maybe it's been 6 months or a year, sometimes you actually have to do a bigger surgery. Either reconstruct that tendon sheath to hold them in place, or deepen the groove that they sit in behind that bone, or something like that. It's an outpatient surgery either way, but the recovery can be fairly long. So if you notice after an ankle sprain those tendons are snapping back and forth across that bony prominence, get it checked out. Go see an orthopedic surgeon that does foot and ankle surgery, or maybe sports medicine. Find out what the diagnosis is, because potentially it's something you could undergo surgery for. Okay, have you dealt with peroneal tendon subluxation, and how did you do it? How did the doctor make the diagnosis, and what did you do to get better? I'd love to hear your experience, and honestly, I think people watching this from all around the world would as well. In the comments below this video, share your experience. I can't answer specific questions you leave there for legal reasons, but I'd love to hear your experience. Now, I'd also love to know the #1 challenge you face with your injury, be it peroneal tendon subluxation or anything else. In the description box below this video, the very top link will take you to a page on my website where you can in great detail describe your injury and the challenges. Now, the point of you leaving that information is that so I can better understand what you're dealing with and better come up with videos and articles, even courses and programs that better help and serve you. So click the top link in the description box. If you like videos like this and you want more information on sports and exercise injuries, injury treatments, and injury prevention, subscribe to my video channel. In addition to recording several of these videos every single week, about every month or so, I do an Ask Dr. Geyer live video, and you'll have access to that if you subscribe to my YouTube channel. So click the subscribe button on the upper right corner of the page. Thank you so much for watching. I really hope this was helpful, and I look forward to seeing you right here next time.